Good evening, students. Today I will discuss one of the important chapters of head neck region is the lymphatics of head and neck. I already uploaded three videos on lymphatic system. One on the basic anatomy of lymphatic system, and second one on the lymphatics of the lower limb, particularly the inguinal lymph nodes, and the third one the lymphatics of upper limb, especially the lymph nodes around the axilla or axillary lymph nodes. And now I will discuss the lymphatic system, or rather the arrangement of different groups of lymph nodes in the head neck region. And I already told in the previous video that the total number of lymph nodes in our body is about 450. Out of 450, in the head neck region, the number of lymph nodes are about 70 to 80. And in the thorax, the number of lymph nodes are about 100. And in the abdomen and pelvis, there the number of lymph nodes are maximum, it is about 250. So 250 plus 100, 350, 350 plus 80, then 430. But total number about 450. So rest of the lymph nodes, they are present in the upper limb and lower limb. And today I will discuss the lymph nodes of head neck region, the number of which are about 70 to 80. Let us see how these lymph nodes are arranged in head and neck. The lymph nodes of this region, they receive the lymph by different afferent lymphatic channels to these lymph nodes, and from these lymph nodes the efferents goes out, and ultimately all these efferents from this region they drain into the venous system of our body. Let us subdivide the lymph nodes of the head neck region, and mainly there are two groups are present. One group, lymph node of head neck, they are arranged in two groups. One is outlying group of lymph node, and another one is terminal group of lymph node. And this terminal group of lymph nodes also called deep cervical group of lymph node. And this outlying group means they are present or they are lying outside the central area. And this outlying group again arranged in mainly two groups. One is groups in the outer circle and lymph nodes in the inner circle. So there are two circles of lymph nodes arranged in the outlying region or outlying group. Let us discuss one by one. I will discuss this terminal part later on. First of all, let us discuss the outlying group. Of this outlying group again, outer circle or inner circle. First of all, what are the lymph nodes of the outer circle? Outer circle lymph nodes, they are present at the junction of the face or the head and the neck. The junction of the head and neck region, this one. Starting from this is the mandible, the symphysis menti. So from there, the lymph nodes are arranged around this junction of head and also neck region up to the occipital region, and they are arranged in both sides. And what are these lymph nodes? If we start from the posterior to anterior side, the lymph nodes are number one, that will be occipital group of lymph node. And the number of lymph nodes usually 3 to 4 in number. And you know this is the occipital bone, and here is attachment of one important muscle called trapezius. So at the level of the attachment of trapezius, there are some lymph nodes are present on the occipital bone, and those lymph nodes are called occipital group of lymph nodes. And second one, if you trace forward, here is the bony process just behind the auricle. This is called mastoid process. So over the mastoid process, some lymph nodes are there. They are called mastoid group of lymph nodes. And here is the attachment of another important muscle called sternocleidomastoid. This one, it is attached on the mastoid process. So at the level of attachment of the sternocleidomastoid, some lymph nodes are there. They are called mastoid group of lymph nodes. And these lymph nodes are present behind the auricle. So these lymph nodes also called retroauricular lymph nodes. That means the second one is mastoid group or retroauricular group of lymph node. Then third one, come forward. Here is a parotid gland in front of the auricle. Here in this region there are some lymph nodes. These are called parotid group of lymph nodes. This parotid group again may be superficial or may be deep. Superficial means these lymph nodes, they are lying superficial to the parotid gland, and the lymph nodes which are present within the parotid gland or rather which are embedded in the substance of the parotid gland, they are called deep parotid group of lymph nodes. So this superficial group also called preauricular group of lymph node. It is retroauricular, and this superficial group of parotid lymph nodes called preauricular group of lymph nodes. Then come further forward. Here is the submandibular region, and here is one important gland is there called submandibular gland. So on the submandibular gland there are some lymph nodes are there. They are called submandibular group of lymph node. Number 4, submandibular group of lymph nodes. If you trace forward, here this is the symphysis mendi, and below here you will get another group of lymph node called submental group of lymph nodes, and these lymph nodes they are present on the mylohyoid muscle, and here the two antervilli of digastric. So in between the two antervilli of digastric over the mylohyoid muscle there are some lymph nodes. They are called submental groups of lymph nodes. So number 5 is submental group of lymph nodes. Other two groups of lymph nodes are there other than these 5 groups of lymph nodes. One of them is the superficial cervical group of lymph node. Superficial cervical group of lymph node. And I told you the terminal group of lymph nodes means deep cervical lymph nodes. But here it is called superficial cervical group of lymph nodes. They are under the outer circle of the outlying group. And these lymph nodes, they are related to the external jugular vein, which is present superficially. And another group of lymph node called the anterior cervical group of lymph nodes. But these lymph nodes are present along the anterior jugular vein, which are present on either side of the midline and vertically placed. So these superficial cervical lymph node and anterior cervical lymph nodes, they are present longitudinally, one along the external jugular vein and one along the anterior jugular vein. So all these are the lymph nodes of the outer circle of the outlying group. And of these all lymph nodes, here is a submandibular lymph nodes. One lymph node from the submandibular group may be present over the buccinator hair and related to the facial vein. That lymph node is called the buccal lymph node. So here is another lymph node called buccal lymph node. Buccal lymph node related to facial vein. So altogether they are occipital, mastoid or retroauricular, then parotid, maybe superficial or deep. superficial also called preauricular, then submandibular, of which one lymph node also called buccal lymph node related to the facial vein, then submental, then superficial cervical and anterior cervical. All these are the lymph nodes in the outer circle of the outline group. Then come to the inner circle of the outline group. And among the inner circle, these lymph nodes are present around the upper part of the respiratory passage and the digestive passage. And these lymph nodes are also named in different names. Number one is called pre-laryngeal group of lymph node. And this pre-laryngeal group of lymph node, it is present in front of the cricovocal membrane. And second one is pretracheal group of lymph node. The pretracheal lymph node, they are present in front of the trachea above the isthmus of the thyroid gland. And number three is a paratracheal group of lymph node. This paratracheal group of lymph node, they are present on either side of the trachea and they are related to the recurrent laryngeal nerve. Then all these three groups of lymph node, they drain the larynx below the vocal fold and also they drain the esophagus, they drain the trachea and also they drain the thyroid gland. So these lymph nodes, they are draining all these areas. And other than these three groups, next group is the retropharyngeal lymph node. Retropharyngeal lymph node means they are present behind the pharynx in the retropharyngeal space, and some lymph nodes on either side of the midline in front of the prevertebral fossa and behind the pharynx, also called the retropharyngeal space. And next group of lymph node is the infrahyoid group of lymph node. The infrahyoid means it is below the hyoid bone here and in front of the thyrohyoid membrane. And next group of lymph node, though these group are not always present, called lingual group of lymph node. And these group of lymph node, they are present over the hyoglossus muscle. So all these are the lymph nodes of the inner circle of the outlying group. So whatever may be the circle, outer circle or inner circle, all these lymph nodes, they drain ultimately into the terminal group of lymph node or also called the deep cervical lymph nodes. And from deep cervical lymph node, they drain into the venous system. I am coming to that part. So let us discuss the terminal group of lymph node or deep cervical lymph nodes. Till now we know that all these lymph nodes, they are efferents, they are draining into the terminal group of lymph nodes, and their afferents, they drain the different regions of the head neck region, maybe thyroid, maybe esophagus, maybe trachea, maybe larynx. So from these areas the lymph drains into these lymph nodes, from these lymph nodes drain into the terminal or deep cervical lymph nodes. Let us see what are the terminal or deep cervical lymph nodes. Deep cervical lymph nodes or called terminal group of lymph nodes. Terminal. This group again divided into two groups. One is superior group, one is inferior group. The superior or inferior means they are either superior to the intermediate tendon of the omohyoid muscle. So above this intermediate tendon, the lymph nodes are called the superior group, and below this called the inferior group. And this group of lymph nodes, they are present along the internal jugular vein or closely related to the carotid sheath. I told you the superficial cervical lymph nodes, they are present along the external jugular vein, but the deep cervical lymph nodes, they are present along the internal jugular vein and deep to the sternocleidomastoid. So, what are the superior and what are the inferior group of lymph nodes? Of the superior group, the most important group of lymph nodes is the jugulodigastric group of lymph node. Here, jugulodigastric. There is the internal jugular vein, and one vein is called the facial vein, and here is the posterior belly of digastric. So, posterior belly of digastric, internal jugular vein and facial vein, they form a triangle here. This triangle contains the jugulodigastric group of lymph node, and these lymph nodes drain the different viscera of the head neck region, particularly the tongue, and maybe from the palate and surrounding tissues. And next group is the inferior group. Among the inferior group, the most important group is the jugulo-omohyoid group. And this jugulo-omohyoid group, it is present just superior to or over the intermediate tendon of the omohyoid muscle. They are called inferior group, or the lymph nodes are called jugulo-omohyoid group. This group also drain the tongue, mainly the trunk. So, from the superior, the lymph nodes, the efferents from the superior go to the inferior group of lymph node, or from the inferior group of lymph node, they drain into the lymphatic trunk. Lymphatic trunk. So, lymphatic trunk, it is the ultimate efferent lymphatic channel from the terminal group of lymph nodes, particularly from the inferior group. From the superior, they directly drain into the jugular lymph trunk, or from the superior, they go to the inferior group, then into the jugular lymph trunk. So, the jugular lymph trunk, where does it drain? If we see, jugular lymph trunk may be right side or left side. If the trunk of the right side, so in the right side, the right jugular lymph trunk, right jugular lymph trunk, they drain into the right lymphatic duct, or they may drain at the junction of right subclavian and internal jugular vein. If I draw, suppose this is internal jugular vein and this is subclavian vein. And so it is internal jugular vein, this is subclavian vein, and this is brachiocephalic vein. So this right jugular lymph trunk, they drain at this junction. And second option is the right lymphatic duct. If it is right lymphatic duct, they join here. This right jugular lymph trunk, they join in the right lymphatic trunk, then ultimately at this junction. In case of left side, called the left jugular lymph trunk, instead of right lymphatic duct on left side, you will get the thoracic duct. So, left jugular lymph trunk, they drain into the thoracic duct, or they drain at the junction of the subclavian vein and internal jugular vein. So, this may drain here from thoracic duct to this junction, or from this left jugular lymph trunk, they directly drain into the junction of the subclavian vein and internal jugular vein. So, both are the possibilities. In case of right side, directly into the junction or via right lymphatic duct. In the left side, directly into the junction of subclavian vein and internal jugular vein, or they drain into the thoracic duct, then thoracic duct again joins at the junction. Ultimately, the lymphatics from the terminal groove, they drain into the venous system. Besides all these outlying groove and the terminal groove, another circular or ring-like appearance or arrangement of some lymphoid tissue are there, they are called the lymphatic tissue of the Waldear's ring. Sometimes there may be a short note on the Waldear's ring. Waldear's ring. The Waldear ring, it is a lymphatic tissue arranged around the oropharynx and nasopharynx in the submucous coat. They are also called MALT, mucosa associated lymphatic tissue. But this lymphatic tissue, they are present in the submucous coat of different regions around the oropharynx and nasopharynx. And all these tissues are called the tonsil. So aggregation of lymphatic tissue means tonsils. So there are different tonsils are there around the oropharyngeal and nasopharyngeal region. So what are these tonsils or lymphatic tissue aggregation? And these are in front lingual tonsil, then on each side tubal tonsil near the opening of the eustachian tube, and behind this the larger one is the palatine tonsil present in the tonsillar fossa, and behind is a nasopharyngeal tonsil. So this is lingual tonsil, this is tubal tonsil, palatine tonsil, and this is nasopharyngeal tonsil. So all these lymph nodes, all these lymph tissue rather, they form a ring called Waldear rings. Waldear is a German anatomist. After his name, Henrik Waldear, the name of this group is called Waldear ring. And their main action is a defensive mechanism. They prevent the entry of the microorganisms from exterior side. So what is the importance of knowing all these different groups of cervical lymph nodes? Because these lymph nodes may be enlarged in different disease condition like malignancy or cancerous condition or any inflammation or infection or tuberculosis. So these lymph nodes are involved. Particularly if any cancerous or malignancy occur in the face region or in the oral cavity, these lymph nodes are enlarged. In that cases, the lymph nodes are removed, which is called the block resection of the neck. In the block resection of the neck, all these lymph nodes are removed, and the resection starts from the lower border of the mandible to the root of the neck, and from this side to side, behind the lateral border of the sternum muscle up to the anterior border of the trapezius. So all these structures of this region, they are removed. But care to be taken not to involve or not to remove some important structures, and that structures are carotid artery is the most important artery of the neck. Carotid artery, that should not be removed, and other structures are, particularly few nerves are there like the hypoglossal nerve, then vagus nerve, then phrenic nerve, then cervical part of the sympathetic trunk. These nerves also kept preserved, not to remove all these things. But sometimes the internal jugular vein and also the axillary nerve may be sacrificed to some extent. But the important structures which I told you, that to be kept in mind, not to be disturbed. So all these are the different anatomical aspect and applied aspect of the lymphatics of head neck region. It may be a long question or maybe a short note on the lymphatics of head neck. So that's all for the lymphatics of head neck region. Thank you very much.